Dr. Laura Dreer is a tenured associate professor in the Department of Ophthalmology and Visual Sciences in the School of Medicine here at UAB. She holds secondary appointments in the UAB departments of PM&R, psychology, and neurology. She completed her neuropsychology fellowship at Duke University Medical Center, as well as a fellowship here in PM&R. As a scientist practitioner and independently funded researcher, her clinical research interests focus on factors related to adjustment to disability or injury, health disparities, and behavioral health and health promotion, intervention, adaptation, implementation, and evaluation to enhance health-related outcomes. So we're so happy to have you here today. Thank you. And I'll let you get started.
Okay. Thank you so much for inviting me. And I think when we talked about presenting this, I was very excited just because of the importance of in the growing field of lifestyle medicine and the attention towards it and how it can really benefit your patients and consumers out there in the community that are living and struggling with adjustment and health related issues post traumatic brain injury. So, and I see a lot of friendly faces. I've gotten some texts, so it's good to hear and see some folks. Hopefully you'll get something new out of this. Heard me probably ramble and stress the importance of this. So very passionate. Let me start out. Just not technologically competent, apparently. Here we go. So part of the, as some of you may know, and hopefully if not, this initiative by Healthy People started with 2010 and 2020 and 2030. I think every issue, it's been focusing more on critical areas for health and the goals. And they've really started to expand in the importance of looking at health and functioning, especially with folks with a disability. As you all are very aware, there's so many different things that people with disability can do. And the best part is getting folks educated, working with people, with others and resources, our group here at UAB, and then all of our awesome partners, Alabama Department of Rehab Services, Head Injury Foundation, Lakeshore Foundation too, that really all work together to help people as well as their families adjust to that difficult process in transition. And some of these healthy goals are important, and they've been on the agenda and will continue to be, just because of, as you see here, increasing number of years of healthy life, they have a focus on quality of life as well as quantity, the years you live, and examining more, eliminating the disparity really of health issues and risk for obesity, for example, and other complications for people with a disability. Increasing inclusion of public health activities. Many of you know Jim Rimmer and his awesome work of expanding upon, sorry, Jenny, I saw the chat thing. Will you filter any chats, or I don't want to miss a question? Or okay, if I'm not loud enough. I can't read it. So increasing inclusion of public health activities. And then as well as the number of well-timed interventions and programs, especially I should mention as technology advances are growing, expanding beyond what I can keep up with myself, at least. And I actually just read an article on a lifestyle intervention based off it, AI delivered. So it was not even a person, it's just with ChatGPT and these other resources. And it was good, but I think people preferred that human contact, but we'll see as that evolves. So while these goals have been encouraging, and it's good that they're on the forefront agenda for policy, for funding, and for development of services, and wide range of services to improve, always constantly improve rehab. These issues can continue to persist and are on the rise in some cases, as I mentioned, with obesity. It's a growing aging population, and as many of you know, the longer life expectancy and medical technologies. So having that focus on a good quality of life is very important. I don't have to focus a lot on this. You guys are all experts with rehab and the goals of rehab and improving physical function and well-being. I just put this slide in here just to recognize all the important work and the focus on health and function that y'all do on the inpatient as well as outpatient services. And I know there's some folks with Alabama Department of Rehab Services that are handed off that torch to help these folks and their families on that transition to adjustment into the community. Now, inpatient rehab is time limited and you're doing the best you can with managed care, a number of days covered. But as we know from the research, and you all know, outpatient services, even after that, there's residual impairments in health. And you're trying to do everything you can, PT, OT, speech language, to maximize that functioning and that community integration. And your psychologists, neuropsychologists to help with cognitive and mental health issues. But some of those, as you know, transition out into the community. And the more worrisome part is some of the research that shows some of the negative impact that can happen once people are out in the community, and the risk factors. Not everybody, I'm not saying is susceptible to these, but these are enhanced post-injury, and the rates of rehospitalization, health complications from the injury, premature death, preventable secondary health conditions that have been shown to be related with disability in general, but also with TBI, sedentary behavior, looks like I repeated that, depression, long-term disability, poor sleep, relationship strain, unemployment. Just gives a wide range picture, sets the context for what I'm going to address with the lifestyle approaches and the need for continuing to address these issues in health well beyond the time at rehabilitation. And this is off the CDC website, actually, just 5-year outcomes. And I'm not trying to be so bleak, but just in terms of mortality rates and some folks becoming worse, 30%, sedentary behavior, as I mentioned, 22% staying at home, and a smaller quarter improving. So there's definitely work to do to impact those and enhance those outcomes. Barriers to participation, healthy living. There's a lot that overlap with other disabilities as well. And these have shown suboptimal participation in health promoting lifestyle behaviors among folks adjusting with a traumatic brain injury. And these probably aren't new to many of you working directly with patients surviving a TBI and their families. But these are a lot of the issues that make it complicated to improving some of those health outcomes in a lot of different areas to consider later when I talk about designing, engaging lifestyle interventions and expanding the reach to folks. And a lot of these habits are longstanding. It's difficult, but that's not to say, as a psychologist, I always believe behavior can change and has been shown to change. So a lot of these, though they're barriers, they are taken into consideration, can be addressed. And I'll later highlight how we're doing that with some of our projects with the model systems. So just by definition, with the importance of addressing health and unhealthy lifestyle behaviors, the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely just the absence of disease. And I highlight that just because it sometimes gets, I think, forgotten, or there's also less of a focus on the comprehensive reach of how we look at health and wellness and all the different components that go into that, which I'm going to discuss. And there's greater emphasis on that. This is a little, I know, text heavy, but just listen to me. Traditional medical approaches to addressing health habits and some of the barriers there with the intention of doing good for patients and the busyness of schedules, and other factors that I know as a provider get in the way of having longer term discussions about health and doing the more skill building. Is your time is limited, and traditionally healthcare providers, the roles assisting survivors to change unhealthy habits or adopt healthier behaviors. But it's typically been historically education, persuasion, or prescription of actions. You should exercise more. You really need to lose some weight. We all know that from doctor or different areas and whatnot, and that's good. But we know when we leave too, the implementation of that, even if there's awareness or there's support from family, is challenging. And like I mentioned, they're well ingrained health habits. So it takes some time. As much as to tell folks, if you gain weight and I'm gaining weight, the time it's taken to gain weight, it gotta think about, it takes just as much to lose it in a healthy manner. So, and to change behavior, not just abruptly, it doesn't happen overnight. So that takes process, and as we go down here, I'll talk about it's more than, want to just piggyback on here real quick, the World Health Organization, stating it's simply just giving that information and advice to patients is unlikely to change that behavior. And the research backs this up. I was going to list a bunch of studies, but I can summarize it for you that that might increase knowledge and awareness, which is good, but that longer term health change is not always supported by that. So it's important to be aware of that. And I'll later get into recognizing that as providers, and also being aware of resources in the community and national initiatives to connect patients to, or consumers. So, and as we know in the research too, it's well documented. I'll get into it. The sustainable health behavior change and health outcomes, especially if you're talking some of the ingrained lifestyle patterns of like physical activity and exercise, or diet, nutrition, those supported behavior changes go beyond the advice giving, and it focus on a lot of the evidence-based interventions, self-efficacy, self-determination, building up the person's confidence that they can do it around barriers that are on top of other barriers for people that are without a disability. They also focus on health responsibility and healthy living, skill building, some strategies and tools that people can use to implement and like self-monitoring, tracking of behaviors, and then ongoing support for healthy choices. Just read another paper recently that folks wanted with TBI, a social gym. And one of the papers was a qualitative study that looked at wanting support if they're doing it from home or whatnot, just getting that support from another person going through similar struggles and trying to change behavior. So this, I mean, the importance, maybe preaching to the choir, is well known. And I think that picture I liked illustrates just that path that can really, that hopefully before getting to that why, where it bridges off illness or health, that we catch folks before that crossover and they go in that direction towards health. Given what we know about secondary health conditions are preventable, a lot of them, or even managing chronic health conditions if older adult has a traumatic brain injury and they have pre-existing health conditions. So it's important to recognize that and get those folks connected, given the benefits of lifestyle and health promotion-based programs. So healthy lifestyle, wish I had this on, given this talk where I pick on people in the audience, but healthy lifestyle, it's a way of life that reduces the risk of health conditions, declines in health, hospitalizations, dependence, promotes independence, and premature death. Some of those health complications I identified earlier, especially for folks with a traumatic brain injury. It also doesn't focus on just one component of health, but an intersection between multiple components, which I'm going to show on the next slide, for engaging in how those different components influence each other, but also overall health. And one isn't more important than the other. And we'll talk a little bit about that when I review just some of the overall evidence basis for lifestyle programs that have been looked at among people with traumatic brain injury, but in general as well. So the components of healthy lifestyle behaviors, this is kind of it's always growing. I think, it used to be physical health and mental health, and then it's expanding physical health, dietary intake, nutrition, eating habits, mental health, and stress management, sleep. And people present this different ways, like a wheel that has arrows influencing it, sort of like this. Social health and relationships. And it's not just one component, as I mentioned. If you're, for example, obesity, addressing that, a patient has to lose some weight, or they're showing a trend towards being overweight, which will lead to obesity. It may be effective a little bit with increasing exercise, but if they're eating pizza, they don't have access to healthy foods, that's going to counteract the weight loss. And then that can also affect well-being and your mood, and your mood can affect weight gain and these other areas, lack of physical activity because of sedentary behaviors and social isolation. So it's important, and it's tricky to treat all those together, or as we typically refer people to their specialty area to deal with it. And I'll talk about those complications of trying to house in and treat lifestyle approaches with one person who kind of knows a little bit about each of the areas, but not necessarily an expert in all, and how you can be mindful of these areas just in terms of working with patients and trying to think ahead about that impact on health and how to connect them. And research these other areas too, even growing research with spiritual health, and I'll talk about that in one of our projects, spiritual health and well-being. And we've also found meaning that as purpose and meaning in life as well. What is my value? I have no purpose anymore. And I think that plays into spiritual health and well-being. We'll talk about that, mental activity and cognitive health, and then also medication management. And there may be others too that also influence healthy lifestyle behaviors. So broadly speaking, based on that premise that increasing health promoting behaviors and lifestyle choices, along with increasing one's beliefs or self-efficacy, will maintain a positive impact on overall health, that lifestyle medicine is a good component to build in to rehab. Patient with these approaches consider an active partner in care, and they emphasize motivation, empowerment, ways that person can take control over their health, and not just that it's happening without their control. And they can elicit that help with a caregiver, family members as well. Skill building, adherence, and relapse prevention. And this may be redundant actually, but accumulating evidence in promotion for end wellness efforts have focused more and more as a therapeutic approach. I know, at least in psychology, when we see some patients, we have health and behavior codes that we can use to try and educate, but also, as I mentioned, address some of these areas, whether it's with diabetes, for example, or problems with adhering to rehab strategies or issues with physical activity, in addition to referring to maybe it's weight loss medicine, but as a supplement. So the research, I want to summarize, just be mindful of the time here too, is increasing with a multimodal approach, with lifestyle programs for survivors of TBI. And some of the existing research, just in summarizing it, has addressed health and related issues with greater focus predominantly on lifestyle interventions targeting a single component. And many of you might be familiar, like cognitive behavioral therapy for insomnia, for sleep, or physical activity focused on yoga. There's Love Your Brain program, and those are great programs for sure. And some do have some components even embedded within it that focus on other areas, but the predominant focus sometimes is a particular health behavior. And there's not to say there's anything wrong with that. That's where the existing research is. Recent evidence is growing off of that multimodal approach that incorporate different areas. And I'll talk a little bit about the trickiness of doing that in one project we have going, and about the benefits though of doing it as well. So these, as I mentioned earlier, focus on that reciprocal impact on those different areas of health and lifestyle that impact overall health. So weight gain, as I mentioned, not only physical activity, your diet and healthy and nutrition intake, and how that can healthy eating and certain nutrients impact brain functioning. There's a lot of studies showing that, the benefits of that, as well as mental health too. So those are important to consider. Of the kind of narrow it down like a funnel, there are unfortunately very few that are more comprehensive. And one is a great collaborator, Simon Driver, who's done a lot of work nicely laying out feasibility and then also evidence and efficacy for adapting a diabetes prevention program group, lifestyle balance program that's well backed up and supported in the research, and was adapted for folks with this traumatic brain injury. The focus there with Simon's work was looking at predominantly weight loss, and used it in a group format. Very promising, good results. And they've also had a recent study published that looked at adapting a mobile app component to it as well. And like I mentioned, that's good. It showed some reductions with weight, which was encouraging. A drawback might be the group-based format for those that might not be able to have transportation issues or barriers. It certainly gives room to develop more. Maybe some that want it individually tailored or don't like the group-based setting or have difficulty with transportation, and all those different components of health too, which need to be focused on. So this is a good one though, that is evidence-based and has been used with folks with a traumatic brain injury with promising results. Just want to take a little turn here because I know there's probably practitioners on here, there's researchers too, and I'm trying to put my head in your shoes. They're just thinking about like, well, that sounds nice, Laura, but what, this is challenging. It's a broad focus. And I know as a neuropsychologist and rehab psychologist that I struggle with it sometimes too. We've had patients referred and physical activity sounds great, but I don't feel confident in my area expertise prescribing. I'm not a medical doctor, even if they're cleared to go ahead and engage in physical activity, how to appropriately get them engaged aside from referring out. But that is an issue, but like there's a lot in terms of like motivational interviewing and ways to prepare and encourage our patients to focus on those areas and talk about those, have those conversations about the importance of looking at physical activity and how it affects those other components of health. And then also the time sufficiently to cover those areas. And I'll talk more about that with our current project that does cover comprehensive lifestyle goals. Medical monitoring can be an issue too. Problems with reimbursement and some areas not traditionally covered, spiritual health and well-being. It can fall under mental health and concerns about liability and lack of access to resources. So didn't want to present all that, and then you're kind of lost. But if you're kind of looking to learn more, and I could do a whole talk on implementing some of these, but CEUs are really good. And I'll share with you on the next slide. And you'll have these slides. I'll give these to Sarah to distribute if anybody's interested. But CEUs are good to enhance your training, seeking additional training opportunities, consultation from experts, becoming familiar. If you haven't been out to Lakeshore Foundation, go. It's a great resource that is offered to our patients. Now, of course, it's convenient for folks around Birmingham area and other areas that can get transportation in, but for those that go to more remote or rural areas, that might be more challenging. So coming up with ways within the community or home to do some lifestyle interventions, and telehealth has been good too. And as I mentioned there, motivational interviewing and promoting readiness to make changes in health and talk with healthcare providers. I think that's a good one as well, versus you need to lose weight, or having those conversations. It does take some time, but it has been shown effective, and Variety Healthcares can use that and when talking with their patients, or also rehab counselors and talking with their consumers out in the community. Keeping in mind that my lifestyle changes take time and reinforce that lifestyle journey. It can be very discouraging to folks, especially with dealing with so many challenges, adjusting life changing after an injury, or dealing with a ongoing chronic health condition, which TBI is now recognized as, versus an end goal. And reinforcing that with families as well, because they can provide a lot of support, and they're stressed as well. And this can also, they find some activities to do together. That's also something taking care of both of their health too. Try to get a multidisciplinary team. You guys have this already, and we have given these talks in ophthalmology here, but they're not as multidisciplinary as one discipline. But becoming familiar with different areas and what are appropriate prescription of activities and how to monitor, and community and national resources and initiatives. And as many of you know, it can take them quite a while, like I said, to change a health habit that's been there for a long time. So being patient, understanding their struggles. This one, I'm sure y'all know Jim River and over at Lakeshore Foundation. This really is an awesome website. I love it. I look to it with patients, and we've used it in our research as well. And Dr. Rimmer's collaborated in helping us adapt one of his interventions, which I'll talk about, for our folks with traumatic brain injury. And it really is a nice tool that's constantly being updated, and it's nice and user-friendly for folks with a traumatic brain injury and their families. Here's another way too that I've learned some more actually about lifestyle medicine, taken some CEUs from the American College of Lifestyle Medicine. They have a variety of topics. I mean, I don't know what they don't have, honestly, in there. So that is another one. It does cost for some of the curriculum activities, but I think it's worth it. So let me kind of pivot here. It's 12:30. And just talk with you. I want to give you, hopefully you have a better understanding of the complex and the multi-components of lifestyle interventions, and talk with you about some of the work that we're doing with the TBI model system and the interdisciplinary team science-based approach to improving health and lifestyle behaviors for survivors of traumatic brain injury. So this is a Project Lift. It's a lifestyle intervention for survivors of TBI. And these were folks out in the community. This is, not everybody can make that picture, but some of our collaborators, there's continuing ones kind of helping us analyze some of the data, accelerometers and whatnot that we hadn't used before. But So just want to give credit there. And this is funded by NIDLR, which has been great for obviously PM&R in the model systems for spinal cord injury and TBI. So acknowledge them as well for supporting this project. And this kind of was based off of one of the projects we looked at with obesity and overweight issues. And this is looking across survivors of TBI using the national database at their most recent follow-up from 1 to 25 years post-injury. And just in summary, the prevalence showing like 59% of survivors with a moderate severe TBI had problems with weight management. And we that was combined with overweight and obesity post-injury. And given that, as I mentioned earlier, that risk for other secondary health conditions, we thought this would be important to address. I will say, looking at it further too, and this is a caveat with the study, and doing like with LIFT, as we learned, it was new territory we were learning from with our collaborators, that, you know, this is based on self-report, and everybody knows that this probably underestimates the real problem, because even our work with low vision patients were significantly just biased in terms of the way they're reporting the degree of their physical activity in minutes, and not intentionally, just difficulty with understanding the definition of moderate vigorous exercise, or you know, as we all are, talk to your doctor. If we had to say our weight, it's different than getting on the scale, which has a different, which is different. So I think it was informative though to this project, and follow-up studies with that, with objective data are definitely needed, long-term follow-up. But it's a issue that we wanted to address, and looking at the adapting a program at UAB, the Eat Right program for people and the issues with people with a traumatic brain injury, and looking at if we can see changes in body mass index scores, body composition, lifestyle behaviors, and other health outcomes. This is an endeavor that, like all randomized clinical trials, I'm learning that it was with technology. So technology can cancel, contracts can be canceled, which happened in this project, and we had to go to another health platform. And so it was a endeavor that I applaud our collaborators hanging in there and being persistent and coming up with another way to present this platform. But just giving you an idea here of the randomized control trial flow chart. And people came in, they were either randomized to the telehealth-based lifestyle program or an attention control condition where it's support. And it occurred over 1 to 24 weekly sessions. And then we followed them up at 7-month follow-up assessment. Recruitment was a struggle in some ways too. I didn't put that in there, but I want to mention that just in terms of getting folks in, and that's for a whole nother talk, just in terms of the criteria we had, being overweight or obese, being able to access technology. There was a lot of criteria, medically cleared to engage in weight loss. But we did, despite all that, enroll 51 participants, and then ended up with 26 in the intervention group, 25 in the control group. Just real quick, just want to be mindful of time and get to the other slides. The lifestyle program was based on UAB Eat Right, and I know a lot of you are familiar, and I know some of you, and I know on the spinal cord injury research side that you had a great paper looking at adapting this as well. And I think that's an important key to these lifestyle programs. You can't just take one and apply it to different populations. I could take this to people with vision impairment, because there's different things that need to be adapted while maintaining the core components of the program. But this, we wanted to try and adapt to folks going through traumatic brain injury. And this has a nice focus, can be customized to individuals' personal goals and health towards weight loss, empowering them to change their lifestyle. It did focus on a couple of different components: exercise, diet, nutrition, of course, and which was more the heaviest, and then exercise, sleep, stress management were also within there. And it was delivered by health coaches, dietitians, specialized in training, weight management, behavioral health issues, and monitored by physicians, board certified in clinical nutrition. And I cut that off, but oops. And here's just an overview of the coursework on both sides, the nutrition and physical activity. Even within there, there's stress management, mindful eating, there's motivational interviewing, but these were some of the core components that were covered in the sessions in conjunction with each other, not just alone. And here's the just screenshot of what was how participants access the program with the health coach over the telephone and the platform here. And they had to-do list, things that we wanted to do, knowledge check. Are they engaging in the, to look at feasibility? Are they engaging in the health platform? Are they learning some of the key concepts? And then quizzes just to engage them. So check on time. Preliminary results from that. We looked at looking at differences between the main effective differences between treatment and control conditions, and those were observed on BMI scores. Hold on a second. And significant interaction was observed the groups for time on BMI scores. Sorry about that. With the control group BMI scores increasing over time. I'll show you on the next slide. And the treatment group decreasing across time. So here we have the intervention effects, more visual. So that dotted line is the control group and the solid line is the intervention group. And at 7-month follow-up, there's trends down, significant trends going down. And this justifies looking at further across, if this was longer term intervention where, for example, Simon Drivers is, and some of those are given, as I mentioned, the time needed for healthy behavior change and the ongoing support in addition to relapse prevention. We also looked at weight. I know BMI can be a little different, but it's kind of similar trends as well and significant. Here's the table, just looking at, it's a lot, but differences, and you can see the significance with the BMI, as I mentioned, in the body weight. Those are the main primary outcomes, but also we did use DEXA scan as well. And patients were able to do that. We didn't have any problems with the DEXA scan, losing some total visceral fat mass. And we also looked at physical activity perception, their perceptions, and then nutrition, which of course, is a trend there, 0.051 of eating healthier, and then also managing stress. And that probably played into the emotional eating component and stress management that were mechanisms of change in the Eat Right program. So that was very encouraging. And that showed, we also have other data too, but those are some of the main outcomes, and like neurocognitive functioning we're looking at. It didn't show any trends offhand with the neurocognitive functioning, but again, it was from baseline to 7 months. Not sure if over longer term studying the impact would be beneficial. So larger samples to further impact the program. We have submitted it as an R01. It actually did get a good score. Not to tell you, Jenny, I just found out, and a good percentile. So hopefully we can pursue it in a larger randomized clinical trial and see some of those gaps that we want to look at further along longitudinally. Got time. I want to make sure I have time for questions, just to give you an overview of our second kind of follow-up to that. Because it was learning for for me at least, moving more with the lifestyle interventions and the benefits. With that, the potential for folks with a traumatic brain injury and the lack of studies that had been done, and some of the satisfaction with the intervention from LIFT, there are other areas too that participants wanted to address. And we felt with this growing attention on lifestyle medicine let's design one if we can, or adapt one that's out there that can potentially and expand upon it to incorporate multiple components of lifestyle and behavior change that lets the patient or the person with traumatic brain injury select which ones they want to work on, what's most important. And this really addresses the NIDLR's health and function, as well as community participation, because of the potential impact that it could have on health and other areas. So we reviewed the literature, and instead of recreating the wheel, there was a really good one with Dr. Rimmer developed, Powers. It was for individuals with intellectual disabilities, and we selected that, and he's a collaborator to adapt. And with Powers, it has a nice platform where, and it's been used for spinal cord in people with a spinal cord injury as well, and adapted with and we kind of looked at that same methodology to adapt for survivors of a traumatic brain injury. And we use the Delphi method to do that among a small sample of about 10 survivors of traumatic brain injury. And then our second objective is to evaluate the feasibility and the preliminary efficacy of the program. So the areas, and this was from the Delphi method, just trying to summarize it here without getting into the weeds of details. We had some of those core ones up to like sleep, but then we got feedback from participants too to incorporate those other areas were meaningful as well and should be included in the intervention as possible health goals that potential participants in the intervention could select and work on. And these were some of the areas that all the participants agreed upon. We had 90% agreement rate that would be beneficial for a person to work on as a health goal. So in this randomized controlled trial, which is ongoing, about to be wrapped up, our goal was set out to enroll 40 participants. And it is our goal. And we had a randomized clinical trial, but it is, I think we learned from Project Lift, the challenges related to and lessons learned when piloting that smaller randomized clinical trial, just in terms of recruitment, and also getting into the intervention and another person to do the attention control, especially for a proof of concept study, which this really is. So we scaled it back a little bit, and here participants serve as their own control group. So they're enrolled, and then they went through a battery of measures on health and function and lifestyle behaviors. And then we had no contact for 6 months, and then did a 7-month telephone follow-up, which served as pre-intervention data collection as well. And then they went through the Powers intervention, which was about 24 to 26 weeks, and then 12-month follow-up. So the intervention overview in a nutshell, it's patient-centered and driven by individual goals and the health belief framework. They interact with a health coach on a weekly basis over the telephone. And we had asked them during the Delphi method, would you want the platform only, the Powers, which we were adapting, and they helped us with that adaptation process, what things were meaningful, and then, or just the health coach alone. And all of them wanted kind of the option of both, but definitely with the health coach. So participants are enrolled, they speak with a health coach weekly, and they're encouraged to utilize the health platform on a daily basis to help with self-monitoring. And we incorporated into Powers health platform a communication, a way to communicate, like a portal, so that the health coach could send tips personalized to that individual they're working with, depending on their health goal. And just kind of going back to the Delphi method, that as part of that, that's a checklist for, we asked participants on that some-month pre intervention and data collection, what goals they wanted to work on in their preferences. And they were asked to also rank order preferences that were most important to them. Just to give you an idea too, these are areas ranked, or they were asked yes or no, would you be interested in physical activity exercise? And you can see majority said physical activity exercise and want that. Mental activity, some cognitive stimulation was also important. And you can just see as they taper down, maybe less with the lower ones with substance use, but those are all areas they rated as health areas that they wanted to work on as a goal. Not saying that every person had to work on these like in this order, but they answered yes or no if it was one of interest. Then we did ask them to rank order so that the health coach would call them about what they wanted. I could have ranked sleep only. Jenny could have ranked spirituality, purpose, and meaning, sleep, and alcohol use for Jenny. But or you could list like several, but you try to cover as many as you can, the health coach. So just to give you an idea though, I was kind of interested, what was the number one goals ranked? In most, the first goal they wanted to work on was mental health, followed by physical activity, diet and nutrition intake. And then you can see the rest of them kind of taper down. And just giving you some feedback, because we're still finishing up, but some preliminary data on the feasibility. How would you rate the quality of the health coaching? Excellent and good. Nobody thought it was a nice range up there. Nobody felt it was fair or poor, which is encouraging. And we do have to a lot of these questions on a satisfaction with the intervention form, qualitative data to explain a lot of these ratings. But I won't get into that today just because of the time. But just to give you an idea too, would you recommend this intervention to a friend? Almost 90% said yes, pretty much and generally. They all, in looking at the responses anecdotally myself as we got a report on them, they look very encouraging. They felt like they were, in general, they felt like they addressed or at least motivated them to start looking at that health behavior. They made some progress on it. Some wanted more. We did ask them about the amount of time and the length of the intervention. Don't have it on the slide, but I would say about 80 to 90 said it was about right. Maybe just 3% said it was too long, and I don't think anyone said too short. It's 6 months. So another, and just for you as practitioners, would you recommend rehabilitation providers refer participants to the intervention? Yes, definitely. Yes, generally. That's a pretty high percentage. So again, I think it's showing the need for this program and the interest from folks. And these, don't think I said, apologize, were survivors. Part of the eligibility criteria, you had to be at least 6 months or more post-injury, just so that we could maximize some recovery during that period. And then they also had to be medically cleared by physician to work on health behaviors and lifestyle issues. So I'm gonna wrap it up there. Just overall summary to take home messages, hopefully you get from this. And if anybody has any follow-up questions or wants to chat further or learn more about motivational interviewing or even these projects, please feel free to reach out to me. But there's a need for more expansive conceptualization of health. And I think particularly for our folks with traumatic brain injury, that need is definitely there, and the interest, without a doubt, based on some of those data that we're starting to see come in. And no one area is more important than the other. I think the data also back that up. You know, we had some looking, the number one goal, spiritual well-being and finding purpose and meaning. after injury. Health education and prescription changes alone are not affected to impact that long-term health behavior change, and finding out where those resources are in the community, what other areas post rehab can help with address lifestyle issues, and our programs that focus on that in traumatic brain injury, and lifestyle rehabilitation programs. Hopefully you've learned offer great promise towards modifying and buffering against those poor outcomes that I described earlier in the talk. And until we have more research within these areas, hopefully similar to other chronic health conditions where lifestyle medicine is a little more advanced, we'll start to see, and I'm confident we will see more of that growing over the next decade, and with technology too, with AI and all these other neat things that are coming. Survivors of TBI might also benefit from health and wellness checkups and screenings, just check-ins, maybe calling and checking up, seeing some of those areas. We're trying to develop a checklist out of that so that that can be used as a tool. But I think that's important to keep in mind, well beyond rehabilitation and into long-term recovery, and for those providers out there working directly in the community, that are really at the forefront of catching these issues when they're well past and out of rehabilitation. I'll pause there since we have 5 minutes. Any questions?